Yes, there's a question over there. Please introduce yourself before.
That's how we do. I'm Abdul Fatoma. I'm from Campaign for Human Rights and Development, Sierra Leone. And our organization ambition is to put women and girls, at the center of all effort to prevent and resolve conflict and promote peace and stability. With that, how can this report be instrumental to UN member states and international NGOs to help to foster, to promote women participation in politics with regards to the resolution 1325?
Yes, there's one here.
Nicola Jones from ODI. I have a question to the panel in general, which is about what do you see as the opportunities within the broader Sustainable Development Goals agenda for advancing a focus on adolescent girls' psychosocial well-being? And within that, what types of indicators and data collection should we be focusing on, given that there's many competing indicators on the agenda as well?
I'll take one more question, and then maybe I'll go to the panel for responses. Any other questions? I suppose I had a question actually to Haji. I was curious about the Survivor project. I was wondering to what extent are mental health and psychosocial support issues included within that? And perhaps you talked about this morning, but maybe you could raise that again. Sorry, that's the chair asking a question. So now, who would like to take the first question about how can this report and sort of findings more generally be taken up in terms of female participation in the UN 1325? Deanne, would you like to respond to that one?
I could. All right. Well, I think definitely the study itself dovetails very nicely with the UN, the global study on the implementation of 1325. Many of the areas that the global study touches on are carried out really in depth in the study. So actually I think the study fits very well and gives a lot of the contextual detail. As you know, with many of the resolutions, these are what we aspire to the mandate, right? These are, as I was saying to other colleagues, these are important seeds that have been planted. Those seeds will not grow unless they are watered, right? So they are very important. All those Security Council resolutions, the Women, Peace and Security Agenda, those are important because the more those seeds get watered by different groups, the stronger that response can grow. And the key really is, as we've heard today from our colleagues, is the work of civil society organizations on the ground continuing to push and push up and also out through their communities, as well as people within the international systems also pushing that agenda. But the key is, as has been very poignantly highlighted by our panelists, is that there has to be monitoring and implementation. These things all sound good. We are getting much smarter about what's happening and what needs to happen. And now, again, it's this push for implementation. And that was the whole reason for the high-level panel, which is, okay, we know we have these standards. We know we have this Women, Peace and Security agenda. What does the implementation look like? And it shows that we've got a long way to go on implementation, but we just have to keep working towards that. So I think that the research uptake team, which some of them are sitting in the audience, this is a great document to start moving. And I think actually because of the 1325 study, it's a very opportune moment. I think people will be, take this up. So that's my comment.
Deanne, any other thoughts from the panelists on this question? Also, Bassam, if you have any thoughts in response to that. Yes, Hasaji.
Yeah, in some very practical terms, so next week, the IAAC, Interagency Standing Committee reference group on mental health and psychosocial support is meeting, and we in fact have Ebola on the agenda. drawing lessons. So I would be happy to take all these reports, give it to the group. And normally what happens is the outcome of that meeting goes into the UN, as recommendations. So I'd be happy to take all these studies and share it, in whichever form it is. Yeah.
Great. Thanks, Saji. So the second question was about the SDGs and what opportunities are there for integrating these kinds of issues into this quite already overburdened work of the SDGs, and also in terms of monitoring them and doing the data collection around them. So I don't know who would like to give a response to that.
Oh, I can just have a go. So we've really struggled, right, to get well-being into the SDGs. We've been working on it. We tried to get mental health into the MDGs. That didn't happen. And now we've got something that's called well-being in the SDGs with no indicators. So there is a website, I think it's called Fundamentals FDGs. I can look it up and give you the actual, but looking at a whole range of ways we might operationalize some indicators around that. Because right now the indicators for SDGs as far as the well-being component is very, very iffy. And so I think that there is an opportunity to be much more focused on what are some of the indicators we can use, for example, adolescent suicide, and really, really kind of hone in on some of the things that we know are going to be very, very key to adolescent success. And I think that does give us an opportunity to do that. Those of us on the mental health side of the aisle are really, really concerned because the SDGs, like the MDGs, remain extremely medicalized. And so how can we make sure that the psychosocial health and well-being of all people, but particularly children and adolescents, get really highlighted, I think is important.
Thank you. Yes?
Yeah, no, just to say that unlike MDGs, SDGs have a specific focus on gender equality and violence. So targets 5.2, 5.3, 16.1, they open up, especially on adolescence and gender and violence. So, I think we are quite hopeful. The space is much bigger than what it was earlier.
Great. So then the question to you, Hadja, about the Survivor Project.
I think it does address mental and psychosocial support because, as I mentioned, it creates a safe place for these female survivors to talk to one another. So it's talking to other people who can relate to what they're going through and help them cope with whatever they're going through, as opposed to talking to their families who in most cases cannot relate to what they have experienced. And so the general idea is, even though they have a structure to follow over the next 12 months, any issues that come up with regards to mental support, psychosocial support, will be addressed as they go along, and empowering them to go back into their communities and become trainers. They're then seen as valuable within their communities. So it helps with that integration back into society, because then they feel like they're important. They're seen as somebody who's important within their communities, as opposed to somebody who's just an Ebola survivor.
So I'll take some other round of questions. Any questions from the audience? Yes.
There's been a couple of meetings that we've been part of with a couple of other organisations like UNICEF and Search for Common Ground, particularly around violence and youth and adolescents and their participation and so forth. And there seemed to be, directly it was suggested by Search for Common Ground, which is a big organisation based in the US, that there would be potentially a Security Council resolution equivalent to 1325 focused on young people and their involvement, particularly in peace-building processes. And I think that UNICEF are quite significantly involved in that as well. And I just wanted to see if that was true. Is that a movement that's going forward? Is it necessary to have a different sort of another mechanism, another Security Council one, or should it come under existing ones or the SDGs? Because it seemed to be an interesting thing, but I was just wanting to see if you thought, is that where it's going?
I only know exactly what you stated. I know there is this move, and there are two approaches. One group thinks you need a new resolution, and the other group, I think, says we don't need one. So I don't know what is the UNICEF's stated position on this is, but I know that there is a group working on it. But I mean, I would be happy to hear what some of you think. I mean, I know Search for Common Ground, and there is a big group even in US and in New York who is working towards it. I mean, people like Ravi Karkara, all of them. I mean, I'll be happy to hear what you think, and then obviously give that feedback to people who are working on it. We have a team working on youth and peace building, actually. Yeah.
I'm aware that whether you wanted to respond to any of the questions that were put forward. Yes, Nicola. No.
I think he's muted.
Oh, he's muted. Oh, okay. I think you're muted. Yes, go ahead.
It's part of Gaza's vulnerability. So yeah, I think it's important to improve the psychosocial well-being of the children, to increase the awareness among the different stakeholders, particularly the policymaker, about the determinants of psychosocial well-being. Because in most of the systems, the health systems are more medicalized, and there is anxiety among health providers to diagnose and to prescribe medications. So I think it's very important to increase the awareness of the policymaker about the determinant of health, how the psychosocial by itself it's a symptom of, but while the root causes are poverty, discrimination, lack of education. So I think there should be more awareness about these key determinants, which really constitute more than 80% of the real causes of the psychosocial ill-being, and to put indicators and to monitor these indicators carefully. And then the psychosocial well-being, it will be just a result of paying more concern to that.
Okay, thanks, Bassam, for that. If there are no other questions, oh yes, there's one question over there. Yes, go ahead.
Hi, this is for Haja. You mentioned about training the survivors of Ebola to go back into their communities to train others and work with their local community groups. How do you intend to sustain your program? Because usually, like I mentioned earlier, when programs like this are put in place, there is no long-term plan to sustain them. And we do know that, I don't know how long your rebuild the lifespan of the rebuild program is, but after your funding stream runs out, how do you intend to make these the long-term effects of Ebola? Because we know that the impacts of conflict is not seen immediately after. Sometimes there is post-traumatic stress disorder, and it takes maybe a year or two for people to start exhibiting these symptoms. How are you going to ensure that there is a continuity?
The Survivor Dream project that I mentioned, it's not part of the Rebuild project. It's purely led from the community. So a group of people within the community have come together, and they're using their resources while they're seeking funding elsewhere, not from the government, to run this program. So it's not part of the Rebuild project as well. But with from what I know about the Survivors Dream project in terms of sustainability and finances, as I mentioned, these people who have taken on this initiative, they're using their personal funding. And it's gaining a lot of popularity within Sierra Leone itself, because it's speaking to an area that there is a need. And I know that they have, they're seeking funding from grant organizations within the West African region as well, and that seemed quite promising. And they're seeking funding from elsewhere, but for now it's purely led by personal resources, people contributing. If they need X, Y, and Z, they go on social media. Can you provide X, Y, and Z? And people from within the community who are willing to provide that will contact them and provide.
Yes.
Thank you. Those were all really, really interesting presentations. I guess I was particularly interested with maybe Liberia and Sierra Leone, the fact that if we're looking at rebuilding adolescent lives or adolescent girls' lives, or more broadly, there must have been a lot of lessons learned from the conflicts in those countries, and I was wondering, how much you feel those lessons were actually applied. I mean, obviously, Ebola kind of is a different type of disaster. So I was wondering whether you basically felt that there was much kind of drawing on what worked in terms of community rebuilding from the conflict versus actually, it was a different situation. It was kind of starting all afresh and not much really happening there in terms of the progression. Thanks.
Oh, that's a really tough one. I think part of the issue is that, well, let me say what I think as opposed to putting out there as a given, that we had Ebola because we did not institute the lessons learned. We had Ebola because, as my colleague said, we had a DDR process that did not include a mental health and psychosocial component. We had Ebola because we had the weakest systems in the world. And I don't even think we have learned the lesson from Ebola around, as I said, we're still struggling to get people to understand that, first of all, you do psychological first aid right after the event happens, not 6 to 9 months afterwards. You don't do things that you know don't work, like psychological debriefing, which many of the INGOs came in and did right there. So I think part of it is that it was an area that was ripe for not having learned the lessons to begin with. I think from what I would say, the funny thing is that we have in our parlance about the war, World War I, World War II, World War III, which is like different phases of this long civil war. And we have the same kind of thing with Ebola, first round, second round, so on, right? And so I think second round Ebola, we kind of learned some of the issues around psychosocial health and how do you support resilience, what do you do in terms of communication so people don't hide their sick loved ones, all of those things. But it took us, painfully getting more and more cases to get to that point. I don't think as a community of implementers and donors that we've necessarily learned the lesson if Ebola were to happen again. Like right now, Guinea has another case, right? And so Guinea is back on the counting list. Have we really learned in Guinea so that the next time it won't happen? Are we just lucky in Liberia and in Sierra Leone that we don't have another case? So I think we've learned some lessons, but I agree with Bassan. I think if something happens, we will have all the donor organizations, everybody coming back and doing the same thing as before. I was saying to Nicola in the break that when we started, probably March or April, we started talking about the fact that we didn't have people we didn't have a system for mental health service delivery or psychosocial service delivery. So can we start building that right now? Oh no, if by the time you start training people, Ebola will be gone, right? And so we never train any more mental health specialists, we never train any more social workers. All these things were like 3-day training or 5-day training, when we actually could have given people intense training to have somebody. And so I think, have we learned that lesson? I don't know. You'd have to ask the people who pay the bills. But I imagine we'll have the same thing, that it'll be response-driven, how much money the donor has. Right now, the biggest kind of scandal is that Ebola survivors, and we have over 1,500 of them, are really not getting any of their needs met, including their medical needs. But there's a lot of research on them. So that's probably one of the biggest scandals.
I think I agree with a lot that Janice has already said, that lessons were not learned in Sierra Leone. If you compare the post-conflict and the post-Ebola phase, lessons were not learned. And If, for example, if I draw on the experiences of the health workers that we captured, a lot of the demotivating factors that they mentioned in the post-conflict period, a lot of them came up in the post-Ebola period. And when you go to do the field work itself, it's like the health workers, they have respondent fatigue. It's like we've spoken to so many people about what these challenges are. What makes your program any different? You know, everybody knows what the challenges are. From the government, from top down, they know what the challenges are. But we have this history of having very nice policy documents, very nice strategic plans, but when it comes to implementation, there's always a problem. For one reason or the other, maybe technical capacity or the resources is not there. So I think lessons have not been learned. That's why I think I agree with what was said earlier, that maybe we should start thinking in an innovative manner and try addressing these issues from the top-down, bottom-up approach. If we could get these CSOs to advocate on these issues, eventually those at the top will listen. Because it's one thing to give them the evidence, it's one thing for them to produce these policy documents, but it's another thing completely for them to invest in them and ensure that they're implemented effectively. Because if I was to give an example, for instance, sexual gender-based violence in Sierra Leone, we have over 100 cases reported every week. We have 62 family support units across the country. But then if you look at the amount of funding that the government has allocated to target sexual violence in Sierra Leone, it's $800 every year. 800.
I have one final question from online, which I would like maybe I'll ask Janice to respond to. It's from Satijat Saka, who has been working on Ebola in Liberia. He's a consultant on risk communication. He asks, the CDC has now found that the Ebola virus persists in human body well beyond 90 days of cure. This can lead to sexual transmission of the virus. How is this impacting Ebola survivors and gender dynamics? So you have 1 minute.
Oh, gosh, thank you. And thank you, Seti, for the question. It's caused a lot of stigma for Ebola survivors. Stigma in their access and care. So one of the excuses for why they're not seen at one of the major hospitals in Liberia, especially pregnant women who have been survivors of EVD, is because the healthcare workers say they're afraid of contracting EVD. So it's caused, I would say, primarily it's caused a lot of stigma. It's caused a lot of irresponsibility on the part of the media. They show pictures of persons with EVD. The first case that we believe were sexually transmitted, they showed the man's picture, his house, everything. And it continues to be a problem for survivors as they live their lives. So I think that's the most important way that it's manifest.
Okay, brilliant. Okay, I'm going to end it now. Thank you so much to all the panelists from the previous panel as well. Suzanne, all the people behind the scenes. I think it was a fascinating theme, and I think we could talk endlessly about it, and a lot of passion from all the speakers, so that was great. Thank you so much, everybody. And we have now a light lunch next door, so please do join us if you have other questions. All the panelists will be around. Thanks very much, everybody.